We're going to talk a bit about how to set up the Hamilton C1 NIV. When you open the tubing, this is the tubing that we only use for this kind of non-invasive ventilators. You won't use it for anything else. When you open it, it has a red cap on the mask end. You can keep this on because you're going to need it for your check. So you can use your fingers to separate the two tubes, and then pretty straightforward, white goes to white and blue goes to blue. You won't need to use this yellow one for anything, so you don't need to actually worry about that. The other bit, as soon as you have removed the plastic that says please remove, but you keep the metal ring in situ, you can just align them together, push this in nice and firmly, and then this one has a little bit of a screwing, so you need to actually screw it in and make sure it's nice and firm. In case that you need to remove it, you need to unscrew it and then pull. Now, this is how you attach them, and then you just turn on your ventilator. This self-check, you don't need to do it every time you turn the machine on. You only need to do it when you attach a new tubing on the machine. So basically, you attach a new machine, you do the check, and then that's it. You can turn it off and it's ready to go on a patient. This check takes a while, as you see here, does a self-check. So it's better practice when you bring your machine back from your transfer, you attach a new tube, you do the self-check, and then it's good to go. So as soon as it turns on, the next thing you want to do is go to the pre-op check and make sure that you have ticks everywhere. The one that you usually might not have a tick on, especially if it's a new tube, is the leak test. So we're going to do it now just to demonstrate how easy it is. So you press on the leak test and it tells disconnect the patient. So you can take the red cap off. And it's going to ask you to block the breathing circuit with your finger, so you can block it. Make sure there's no leak or anything, otherwise it will fail. And then you just reconnect either the red cap or the test lamp, whatever you have in place. And you have a tick here, so you know that this is good to go on a patient. You can turn it off, you can put a plastic bag over it, and then that's how we know that it's checked and ready to go on a patient.